There is a serious shortage of healthcare providers in the U.S., which is due to the growth and aging of the population and increase of retiring providers. Another factor is the cap placed by Medicare back in 1997, which provided support for graduate medical education or GME, and this has created a bottleneck for the physician workforce. By 2030, research shows that the nation will face a shortage of providers between 42,000 and 122,000 physicians that will impact primary and specialty care. To properly train a physician, it can take up to 10 years, and it can take up to 8 years for a practitioner. Therefore, it is imperative to use a multi-pronged method by incorporating tactics such as team-based care, utilizing nurse practitioners, and the use of technology and using technology more efficiently to deliver optimum care. Historically, Mississippi is a medically underserved state with meager results for core health indicators. To enhance the health and well-being of Mississippians, access to quality preventative and primary care services is essential. In 2016, Mississippi had 186.1 active patient care physicians per 100,000 population, and we still need 1,715 more active physicians just to meet the state median. For the state of Mississippi, the number of active physicians over the age of 60 is at 32%. Research forecasts that the shortages of RNs in the South and West to be extreme, especially nurse practitioners. One solution to the shortage this clinic will face would be to offer residency positions at the clinic for nurse practitioners and physicians. This will place the clinic in a position to receive subsidies from the government, such as Resident Physician Shortage Reduction Act of 2017. It is a nationally funded public policy that this clinic will qualify for, includes investments in the Teaching Health Center GAIN program and primary care residency program expansions. Over a 5-year period, this clinic would receive a portion of the $230 million set aside by the federal government. Individuals who obtain regular primary care, receive more preventative services, comply with their prescribed treatments, and have lower rates of illnesses and premature deaths. And this is because of an effective team-based approach to care. A team-based approach provides guidance to patients while navigating an intricate healthcare system. Patient engagement and compliance with healthcare directives are also increased with a team-based approach. Some challenges to the healthcare provider shortage in Mississippi include increased demand and aging physicians and nurse practitioners. Many rural primary care practitioners are nearing retirement age, with nearly 30% of rural primary care practitioners are at or nearing retirement age, and younger practitioners only make up about 20% of the current workforce. The number of practitioners entering the workforce is not enough to replace the retiring primary care practitioners. Since the baby boomer generation began reaching retirement age, it is hypothesized that the rural population of individuals between the ages of 55 to 75 will increase by 30% between 2010 and 2020. This increase will cause major implications for the demand for services for individuals as they age. And an additional 5 million rural patients have health care insurance thanks to the Affordable Care Act. And this expansion has dramatic effects on the meager rural healthcare delivery systems.